各位委員，咁已經夠法定時間，亦都夠法定人數。咁
Right, members, we've got a quorum already, so may I now call the meeting to order. Information papers issued since the last meeting. We have an information paper provided by the administration on the latest developments of the legislative proposals to enhance the regulation of pharmaceutical products in Hong Kong. In fact, we've got two such documents, one issued on the 17th of December last year, one on the 15th of January this year. Agenda item number 2, items for discussion at the next meeting. Let's invite the administration in. We've got the list of outstanding items for discussion and the list of follow-up actions. And we've received 4 letters. Mr. Vincent Fang has written to me on the legislative proposals to enhance the regulation of pharmaceutical products in Hong Kong. And then Mr. KK Kwok has written 2 letters, one on Madam Yixiu Ling incident, and another one on issues relating to the surgical outcomes monitoring program of the hospital authority. And then Mr. James Su and Mr. KK Kwok have written a joint letter on the HA's handling of a complaint against a cardiologist.
咁下次委員會就要17號。
The next meeting will be held on the 17th of February, Monday, 4:30 in this conference room. The administration has proposed that we should discuss redevelopment of Queen Mary Hospital Phase 1 and also the General Outpatient Clinic Public-Private Partnership Program in Kwun Tong, Wong Tai Sin and Tuen Mun districts and progress of the Chronic Disease Management Shared Care Program. Right? So can I ask members whether they've got any views concerning the 2 items proposed by the administration, Queen Mary Hospital and also General Outpatient PPP program? Chairman, I have no particular views on the 2 items proposed by the administration. But then, Chairman, we've got a total of 3 letters. I'll deal with them later. But Chairman, these matters are matters of concern to the public. Yixiu Ling and also the surgical outcomes monitoring program of the HA and also the incident relating to a cardiologist. And I believe these items are as urgent, if not more urgent, than the items proposed by the administration. So should we have a special meeting, or should we have a longer meeting to discuss these matters? Now, members, what do you think? In fact, these 2 items are funding proposals. So they will come to us first, and then they will go to FC for funding. Yes, the first one, Queen Mary Hospital. As for the other one, it's just a progress report to the panel. All right. So, members, what do you think? And then we'll deal with B. All right. Legislative proposals concerning to enhance the regulation of pharmaceutical products in Hong Kong. Mr. Vincent Fang. Chairman, there was a public hearing. And at the public hearing, a lot of comments were made, and I believe the administration heard the comments very clearly. The secretary said that, in fact, everybody supported the idea, but in fact, that was not the truth. I understand that the administration will take a series of follow-up actions after the public hearing. So at the public hearing, we heard such a lot of comments and concerns. And I understand the administration has taken some follow-up action and will take some follow-up action. So what are you going to do? I mean, the administration. I hope that we can have a follow-up discussion on the matter. All right. Mr. Vincent Fang hopes to follow up on this matter at a meeting of the HS panel. The administration has said that the legislative proposals or the bill will be tabled in the Council in the first quarter of 2014, and the administration is of the view that follow-up discussions can take place in the Bills Committee. So Mr. Vincent Fang wants the panel to have another discussion on this matter, and the administration is proposing that members can discuss the matter again in the Bills Committee. So members, what do you think? You just tell me which option you support. There's no need for you to go into detailed arguments. Chairman, Mr. Vincent Fang suggests that there should be another discussion in the panel, and the administration is of the view that members can discuss the matter further in the Bills Committee. So can I know more about the two options, the pros and cons, and the implications? Now, members, if you support Mr. Vincent Fang's suggestion, then we will have a discussion in the panel. But of course, the administration may decide not to respect this panel and may decide to table the bill in LegCo as scheduled. So do members agree that the panel should have another discussion on the matter, either at the next meeting or at a special meeting to be held? Members? Mr. Chen Kin-po, Chairman, I think we need to understand the issue and the implications. In fact, the pharmacists have approached me and they have reservations and concerns about two issues. So we need to know the implications. We can't just support Mr. Vincent Fang because we like him or support him. Now I think so. You can't tell me that you don't know what's happening. You want to make out what is happening. Can I ask the administration why it is unwilling to make any concessions? All right, Secretary, can you tell us or why you want to table the bill in this council in the first quarter of this year? Secretary, now we've already responded to the comments received. For example, now if during the operating hours of a pharmacy, a pharmacist has to be present. On this one, we've already made concessions. So I want to say that we've already made concessions on this one. And then second, the written order, that's not in the law. The PPB will consider this matter when it drafts guidelines. So this order will not appear in the bill. So my understanding is that these are the two most controversial issues. On the first issue, we've already made concessions. On the second one, that will not appear in the bill. So it's not true to say that we are unwilling to make concessions. It's not that we are bent on tabling the bill in LegCo, disregarding totally public views and comments. Yes, I understand that you've made concessions on 7 to 8 issues, but then there are still different views between the administration and the industry on 2 matters. Concerning the proprietor having to hold the key, so to speak, I am not too familiar with this subject. Maybe doctors like Dr. K.K. Kwok know the situation better. Yes, Chairman. In my view, the bill is necessary. The government needs to step up the regulation of the manufacturing and sale of pharmaceutical products. Now, the matter before us is whether we should have another discussion in the panel. And I think we should have some discussion before the Bills Committee starts its work. I understand that there are bound to be comments, and whether this bill can be passed, whether this bill can get support, depends on whether the administration has listened to public views. So I would agree that we have another discussion in this panel first, before we have discussion in the Bills Committee. All right, so members have nodded their heads. So I'll arrange for the issue to be discussed in the panel. So if you want to table the bill in this council in the first quarter, so I'll see when we can have a discussion in the panel again. And there's no need to invite the deputations to come. Now, we met over 30 deputations in a public hearing. But, Chairman, last time at the public hearing, we heard the views of the deputations. And I think when we have another discussion, if the deputations are interested, they can observe and listen to our discussions in the public gallery. And then we've got 3 letters from Dr. K.K. Kwok. One of them is a joint letter with Mr. James Toh. So 3 issues. Now, first of all, surgical outcomes monitoring program of the hospital authority. Now, of course, this is related to public interest and it's related to government policy. So I think members have no objection to discussing this matter, right? So we'll try to find a suitable slot for discussing this matter. And then, the panel discusses and deals with policy issues, and it's not appropriate for the panel to deal with isolated cases or individual cases. Mr. K.K. Kwok. Now, concerning Madam Yik's incident, I have not written to the panel on it because I understand that we should not interfere in individual cases involving individual patients. But then recently, we've heard a lot of news, and the public are concerned. And so this is no longer an isolated incident. They want to know the arrangements for patients in the clusters or at the cluster level. And then second, whether there are systemic problems. I understand that the panel should not discuss isolated incidents, but then I think perhaps we should have a discussion on reconstructive surgery and also communication between different clusters.
So I'm not sure whether he's the chairman or ex-chairman. He says Hong Kong has no problem in handling this procedure. So why do we have a situation where there's no problem, but this patient had to seek medical care outside of Hong Kong? So that means the hospital authority can't handle the procedure, and I hope we don't see any more cases like this in the future. Any other opinions? Zhang Laiwan. I think legislators should follow up on matters of public interest, but should this be an agenda item? I think we should have it discussed in the panel. let me provide some of my own views. If Mr. Kokake feels this is a systemic issue, so if I include this as part of the monitoring of effectiveness of HA as a policy matter, should we handle it as such? If you refer to the Yixiuleng case or a cardiologist, it's also a surgery efficacy issue. So a cardiologist has been suspended. This should also be part of efficacy management policy. So if we include this under the umbrella of HA's provision of service management policy, Mr. Kokake, placing it under the same topic is not a problem, but the stakeholders of these two incidents need to be present. Let's say the HA representative cannot help us understand the details, for example, of the situation in the Prince of Wales Hospital, then we would like Prince of Wales or NT East Coast Cluster or CU representatives here. I think Dr. Zhang or Dr. Liang cannot answer on everybody's behalf. The relevant stakeholders should be present. Well, I can tell you all three incidents are related to Prince of Wales, the cardiologist, Ms. Yixiuleng, and the surgery efficacy. Let's ask a secretary. The HA's service, the monitoring of HA's service provision. Chairman, I agree with you. If we examine the clusters under the HA, how do we monitor procedure and surgery efficacy, or the arrangements of surgery, such as qualifications of the surgeons and so on? Well, if the panel decides, then the administration and HA will have the relevant officials attend. But if you're talking about universities who are beyond the system, well, then it's up to the panel to invite who you'd like to invite. So we'll include these three items. So let me suggest, we might not be able to handle all the issues next meeting. So could we identify a time slot after the Chinese New Year and have one meeting to deal with these? We don't need 2 hours for the pharmaceutical products, so we just need an extra meeting. 2 items, surgery efficacy and the legislative arrangements of the pharmaceutical products. We'll have to handle it after Chinese New Year. Then let us proceed to the policy address. So could you take us through? Thank you, Chairman. In the face of the aging population, we will undertake new measures to ensure the public's health and maintain a high level of medical service. The new measures will include, in the public sector, we will continue to enhance medical services. Some examples being between 2014 and 15, we will add more than 160 beds in hospitals where there is higher demand. we will have the Caritas Hospital Ambulatory Center was completed last year, and will also complete the Yanzai Hospital this year. We also will handle 4,700 new cases that are on the waiting list, and we will enhance the computer scanning and ultrasound scanning service. With reference to the Tinsui Outpatient Care Center, the HA will adopt the private-public participating scheme in Guntong, Wangdaixin, and Chunmun. And if you agree, we will provide you with the details of the plan. So in light of aging society and increased demand for hospitals, for medical services, we'll also strengthen our services for the elderly. In 2014, the EHV has been regularized. The policy address also mentioned that the elderly health care voucher will increase, will be doubled to $2,000, and the extra $1,000 will be deposited in all the accounts. And in this year, we'll extend the outreach dental services for the elderly, and in light of the aging society, we'll work with the Labor and Manpower Bureau to establish the possibility of a comprehensive elderly care center. We'll look at the possibility of having an integrated elderly center. Now, colorectal cancer is increasing in Hong Kong, and in 2011, according to the HA database, we have some statistics from 2011. Starting from that year, it is the most prevalent form of cancer in Hong Kong. So in order to have early screening and prevention, the government is proposing to provide screening for high-risk groups. And in this year, we'll start work on a pilot scheme. Fifth, in TCM, development of Chinese medicine, the government will be looking at promoting TCM. The government has accepted the panel's suggestions and has set aside land in Zhongguanou for TCM use. So we'll have a Chinese Western cooperation approach, and we will invite the TCM bodies to operate this TCM hospital on a self-sustaining approach. So we will be providing a combination of Western and TCM healthcare. And regarding sustainable measures, these include adding and upgrading public healthcare facilities. First of all, aside from enhancing services, we will, in the Langtao Hospital, it has already commenced operations in September last year, and they have extended their A&E operations from 8 hours to 16 hours. We've also set aside land in the Kai Tak area to build a new comprehensive acute hospital. It will provide A&E and will also provide pediatric services. We'll expand, there's upgrading of Kwangwa Hospital, the Union Hospital. So the Hospital Authority will also utilize funding approved from LegCo last year of 13 billion, and as we also promised last year, there is a steering group set up to review the HA's operations. The They will hold their third meeting this month, and they will meet with the different stakeholders to understand the public's views of the HA and to complete a review. 8th, we will strengthen psychiatric services. We'll strengthen our mental health services. So the FEHD in May 2013 had set up a mental health review committee to help formulate policies for the future. At the same time, the government in the coming year will increase resources for the HA and provide and the next generation pharmaceutical products, and they will also expand the mental health services to the 18 districts in Hong Kong. The 9th area is electronic health record. In 2009, the LegCo had approved funding for a decade-long electronic healthcare program, electronic record program. The program is proceeding smoothly, and we are now developing a territory-wide electronic health record sharing system. It will cover consultation on privacy, and we will be submitting the relevant bill this year. So after the LegCo has endorsed it, then we would like to implement it at the end of the 4th quarter in this year. We're also developing the healthcare system, including insurance products. The health protection scheme will include monitoring, and we are also looking at tax incentives in the insurance program. We plan that in this year, regarding the health protection scheme, to consult the public, and regarding private hospitals, we have set aside land in Wong Chuk Hang for a private hospital last year. We are also considering having development of private hospitals by different bodies. We will balance society's needs and set the direction for private healthcare. Review of private healthcare institutions. In 2012, we set up a steering group on reviewing the private healthcare institutions. So we are now in the conclusion phase. The steering group has decided to put forward certain measures regarding high-risk procedures, and we will consult with the public and have legislative work later on.
Now coming to the surveillance, control and notification of communicable diseases. Now we'll continue to implement the government vaccination program and the vaccination subsidy schemes. We'll also try to minimize the risk caused by a flu pandemic. And in fact, we have seen a spate of H7N9 cases, and so the alert level has been raised to serious. And we've also adopted a series of measures to try to minimize the risk of avian flu outbreaks and human infections. We'll continue to maintain vigilance and review the relevant policies as appropriate. As members are aware, concerning live poultry from the mainland and also live poultry from local farms, we've already got the rapid PCR test, and from Friday onwards, at the Man Kam Cho border crossing point, with regard to live poultry from the mainland and also live poultry from local farms, will be implementing the serological tests. And we hope that the test can help us detect H7N9 infection in live poultry from the mainland. At the moment, we have scattered cases of H7N9 human infection cases, and also there were some market samples tested positive, but then we're not asked to respond to these, and so we hope that a serological test can help us detect any H7N9 infection. Now, according to the experts, H7N9 is transmitted from poultry to humans. We cannot rule out the possibility of limited human-to-human transmission. But then I want to say that concerning some recent reports, the CHP is following up on this matter. It has been reported that, in fact, 2 members in the family have been infected, and a medical worker has also been infected. I'll finish very soon, Chairman. And this is of great concern to us, of course. But then we haven't had evidence of continuous human-to-human transmission or continued human-to-human transmission. But then we'll try to collect as much information as possible to help us carry out a new round of risk assessment. I thank you, members. Each of you will have 4 minutes. Questions and replies. Wang Kwok Heng, KK Kwok, Chen Kin Po, Chen Kwok Chu, Pun Siu Peng, Chan Chiu Ho, Mok Nai Kwong, Albert Chan, Alice Mack. All right. Chairman, I want to say that I welcome the idea of doubling the amount under the elderly healthcare voucher scheme. But I want to say this. Now, the $1,000 can be accumulated to $3,000, but then that means 3 years. But I understand the proposal is that will be an accumulation of 2 years only, $4,000, because we're talking about $2,000 per year. So I just want to know whether you can allow elderly citizens to accumulate the voucher value to $6,000, in other words, for 3 years. And I know people can get their MPF payments at the age of 65, and yet they are entitled to the elderly healthcare vouchers only when they've reached the age of 70. So they hope that they can also be eligible for the scheme. Now, as you are relaxing the scheme, can you lower the age to 65? That's the first question. Second, now I welcome the proposal in relation to colorectal cancer screening. Want to know how you're going to select people for the screening. And what if members of the public want to be screened? So what should they do? 2 questions. Yes, Chairman, thank you. Thank you, Mr. Wong. Now, concerning the elderly healthcare voucher pilot scheme, so the cumulative value can be up to $4,000. That was 2 years. Now, we think this is appropriate. Now, if we allow the amount to be accumulated further, then of course the merit is that elderly persons will be able to make use of the amount to undergo more expensive medical procedures. But then this is for primary health care and prevention. Now, at the moment, $1,000 per year, accumulating up to $3,000. Yes, previously $1,000, and then accumulating to $3,000, but now accumulating up to $4,000. That would mean 1 year less. Now, I was trying to explain that, yes, I understand that if you allow accumulation to a larger amount, then elderly citizens can make use of the vouchers to pay for more expensive medical procedures. That's the merit. But that would mean that would go against our intention. We hope that this is for primary healthcare prevention. We hope that when elderly citizens fall ill, they should seek consultation and treatment as soon as possible. I want to say that when Hong Kong have an average age expectancy of 80 years old, and also for this elderly healthcare voucher scheme, there is no means testing. So we'll increase the annual voucher value first, and then we can consider whether the arrangements for the scheme can be enhanced. All right, we'll deal with colorectal cancer later. Dr. K.K. Kwok. Now, I want to say that in this policy address, little is being proposed to enhance our medical and health services. Now, there are many problems with our healthcare system, but then these problems, of course, are not highlighted in the policy address. Now, now there are problems like coordination, lack of coordination among the different clusters, and also we're concerned about surgical outcomes of the different hospitals. Now, some years ago, the government said that it wanted to encourage the development of private hospitals. 4 sites were made available, but now the scale of the program has shrunk, and the Cheung Kwan O site has been earmarked for the development of Chinese medicine hospital. We're not against this idea. No, there is this site in Kowloon Tong, and Baptist University wants to develop a hospital on it. All right. So you are taking away these private hospital sites one after another. I understand that the government is concerned about the vulnerable groups in society, but then the middle class do not have adequate access to private hospital services. And residents of Cheung Kwan O will have fewer choices. So why is it that past promises have been scrapped? And then concerning the healthcare voucher scheme, yes, it's good to increase the value to $2,000, but then the vouchers do not cover dental services. Do you know that if an elderly citizen wants to have a denture or what, then the amount may exceed 3 times the annual value of the vouchers? No, elderly citizens, many of them are not eligible for CSSA, and they cannot afford to pay for very expensive dental services. Why is it that the government is so reluctant to provide public sector dental care services for elderly persons? We're not talking about dental services for the whole population. You know, in Kowloon East, in NTU West, the average income is low. So resources should be used to provide public sector dental care services. You know, there are some elderly persons who cannot use up the $2,000, and there are some who don't have enough subsidies. Secretary, now concerning the hospital authority clusters, as I've said, an HA review committee has been set up. A committee on the review of HA has been set up, and so I will not go into the details here. And then development of private hospitals, I want to explain that there are 2 aspects. Now, it's true that we are treating the different sites differently. In fact, we want to develop the private sector in order that there will be a balance of the public sector and the private sector that will help take some pressure off the public sector. And of course, we will be developing the HPS, and we also hope that NGOs can be providers of healthcare services. From now till 2020, different organizations are proposing to operate private hospitals, and some present private hospitals will be expanded. And if all these programs succeed, then the total number of private hospital beds will be increased by 40%. And so we need to be very careful. Should we expand the capacity of private hospitals substantially within a short period of time? And because we have to consider possible problems like the flow of medical staff from the public sector to the private sector. We'll deal with dental services later. Mr. Chen Kin-po, and the Federation of Insurers will have a meeting with the administration at the end of this month. So I hope that the government will be open-minded. Now, you're saying that a 10% increase on average will be acceptable. Now, as you know, the HPS will be provided by the insurance sector, not the government. And then concerning the $50 billion, we'll now only have about $4 billion. The rest will go to the public sector. In fact, you can do both things, not just one of them. You can't simply rely on tax incentives. Tax incentives alone cannot encourage and attract people, especially healthy and young citizens, to take out insurance. And then private hospitals and the development of these hospitals, I'm disappointed and I'm worried. I hope that the government can tell us very frankly what your plans are. You're talking about an increase of 40% till 2020, but still, I think you're only talking about 1,000 beds only. Is that enough? And you are worried that doctors and nurses may leave the public sector and join the private sector. Now, in fact, we are always asking you to allow doctors practicing outside Hong Kong to practice in Hong Kong. Do you know that in the UK, the country spends about $10 million on each medical student? Why is it that Singapore allows the registration of foreign doctors and not Hong Kong? We need more doctors. We need more nurses. Do you know that even if we want to go to a private hospital, we have to wait for a week before we can get a ward bed? And our population is aging. It takes at least 7 to 8 years to identify a site for a private hospital and to construct the hospital. So, I want to say that during my term, I will continue to press you for more and adequate private hospital beds. This is very important. Secretary, yes, concerning the HPS, I agree entirely with Mr. Chen Kin-po. The insurance sector is a very important partner of the government, and so we will communicate more with the industry.
Private hospital provides some 4,000 bed spaces. Currently, the Wangzhou Hospital, if it is built, it will have 500 beds. The Chinese U, they have stated openly they want to build a hospital. They might have some 200 beds, but if they build to the maximum, they will have 500 beds. So if you look at other bodies who are proposing to build a hospital in Guntong. There was also a closed hospital in the mid-levels, and one body wishes to rebuild there. Plus other private hospitals who are expanding. So the figure is not what you said. It's more than what you stated. Next, Zhangguoqu. It has been mentioned that the Labor Welfare Bureau is undertaking a project, and this seems to be a new initiative. So why have they initiated this project, and what are they going to do? Is it for cognitive disabilities? When will the work commence? How many community facilities will you build? I also want to follow up on Gokake's question of dental service. You are now providing some services, ambulatory services for 59,000 people. Could you expand it to single elderly patients? Some already CSSA recipients, but some elderly who are not on CSSA, they are also disadvantaged. They might not have so much money. So how will you assist these people, especially for those who are in the queue for hostel services? The Elderly Health Assessment Pilot Program, you have forecast a demand of 10,000, but you've only been able to serve 500 people so far. So what's the progress? Well, thank you for the questions. So regarding dental services, we understand that some elderly are not on ECSSA, they're not in hostels. The Community Care Fund had provided a limited program. The administration is now working with the fund to relax the threshold for provision of services. Let me refer to the last question, and the Permanent Secretary can respond to the second question. The Elderly Health Assessment Pilot Program, well, when any program starts, it will start at a slow pace. We agree that we need more promotion, especially with our NGO partners. We want to expand the scope of our service. Mr. Yun, regarding the elderly comprehensive service, in light of aging, healthcare is an important part for a elderly service. So during the two peak flu periods, we have serious problems in A&E of hospitals. So we hope that we can provide a new service where elderly care, healthcare can be combined. For example, some voluntary groups who are operating old age homes. We would like to include healthcare into these services. For example, if we have a large service where they have elderly service, dental service, they have hospital services, then aside from serving the enrolled elderly, they can also serve the community. So this would improve the quality of life. The elderly don't have to be sent to a hospital. It's like a traditional Chinese medicine where the doctor will come visit the patient. So this is a new concept. We would need to cooperate with the different government departments to identify a location, the NGOs, and come up with a plan. That's our direction. We have not been able to identify an actual site yet, but this is a comprehensive program. Pun Siu Peng. Just now, the Secretary said he would strengthen community health care, and there are some new initiatives. So I'd like to follow up. What are your specific plans? In the past there was insufficient manpower, so will all A&E see an improvement? Second, in the policy address, you are providing an increase in the elderly health care voucher from 1,000 to 2,000, but it has been mentioned the age threshold of 65. So could you relax the age threshold a little bit so that they can start receiving the voucher earlier? Because with early intervention, it can reduce the need of future healthcare services. Have you done calculations in this? And I'd like to also follow up on the TCM hospital. The Secretary said that you would conduct some studies. You'd look at cancer, strokes, victims, and combine treatment with Chinese and Western medicine. So does this need double resources or extra resources? So for private hospitals, would you provide them some operational guarantees? I'll let Dr. Zheng answer the first question. The second question regarding the elderly health care voucher, we've done all the mathematics, but I still feel that resources should be focused on the amount each person can use. Well, now, of course, other people might not everybody can benefit from it, but if we have more and more elderly, especially those in the general outpatient, if they go visit the private sector, then we could reduce waiting times, queues. Regarding your question about TCM, you refer to double resources. Are you referring to human resources or subsidy? My understanding was that public hospital were treating patients, and then you're telling them now you want to combine Western and TCM. So do you need extra resources? Well, this hospital will not be a pure TCM. There will be Western medicine participating or cooperating, but we've chosen these three types of patients because we feel these three types of patients, there is more literature regarding efficacy in treatment of these types of diseases. So let's say we have a stroke victim whose condition is stabilized and they need a long-term recovery, then they will refer to this hospital. In this hospital there will be TCM and Western medicine practitioners, but the roles are different. So TCM might have a more important role. Mr. Fernando, Mr. Mok Lai Gong, I'd like to follow up on the electronic health care record. You had mentioned that in the first quarter you will submit the bill, and it would be enacted by the end of the fourth quarter. So in order to have this panel, the panel members or even other legislators understand the system, because I feel a lot of legislators might not be familiar with this topic, so could you make arrangements, because you mentioned we'll have some results in this first quarter, so could you arrange for a site visit, not just at the HA, could we visit the private sector as well, because you want to develop a territory-wide electronic system. So I'd like to ask, you mentioned 11 private clinics who are participating in the program, this pilot run. Even though they're called clinics, are they large hospitals as well? In 2014, you want to legislate, and these institutes, will they participate in the final program? Because they're in the pilot program now. So if the legislation is endorsed, you have to do a lot of promotion. But the paper just says, it just mentions the legislative work. So I suspect that a lot of promotion, you need to promote this amongst the public. Thank you, Chairman. I'll have Mr. Yun respond. Thank you, Mr. Mok. The electronic health record sharing system, well, we have private hospital participation. We have their agreement. The HA is doing its system, and they are helping the private hospitals develop their electronic system. So we want the two to integrate. We're conducting a lot of pilot programs. So basically, all private hospitals will participate. Regarding promotion, we've conducted several rounds of consultation. We looked at issues regarding privacy, and there has been widespread promotion. Our focus right now is to draft the law. When the bill is scrutinized, we will coordinate our promotion efforts. You suggested a visit. We are willing to do so, and we can liaise with the Secretary. I'd like to ask questions about privacy. So, have you met with the Privacy Commissioner? Yes, definitely. According to the Privacy Commissioner, we need to engage a consultant to review and design the privacy requirements. In fact, the whole procedure, we had close liaison with them, including the drafting of the law. So we will consult them as well in the future.
Dr. Fernando Zhang, thank you. Now, in fact, these health services related proposals mainly relate to elderly persons. They're talking about the enhanced elderly healthcare voucher scheme, and then there will be a dental services for the elderly, and then also an integrated elderly centers, and also health assessment for the elderly. Now, of course, these are all good suggestions. But I want to know why you haven't considered the needs of the disabled in your proposals. No, I think we should have in mind those who need long-term care. And so we should be talking about elderly persons, disabled persons, as well as the chronically ill. Chairman, in overseas countries, they have long-term care policies. And there are similar arrangements for the different groups I've mentioned. But in Hong Kong, the arrangements are very fragmented. Now, for those suffering from dementia, you shouldn't simply think they are over 60. And they need long-term care, and so do disabled persons. So why is it that you haven't taken into account these groups? So when can we start considering long-term care needs, taking into account both the healthcare and the welfare dimensions? You shouldn't really distinguish very clearly the elderly from the disabled. Now, there are disabled persons who suffer from deteriorating health. They may not be 60 years old, so they can't make use of the services provided for elderly persons. So I think a holistic approach should be adopted. Yes, Chairman, I agree with Dr. Zhang, but then we have to look at things from both angles. Now, for elderly healthcare voucher pilot scheme, there is only one criterion, and that's the age criterion. And with regard to dementia, in fact, I've already said that for the Chinese term, it should be 認知障礙症 and not 老人痴呆. Now, for groups concerned about these patients, they hope that there can be an isolated scheme for this category. In fact, we've set up a working group to review our mental health services. And we hope to work out arrangements from early detection, intervention to care. Mr. Albert Chan. Chairman, in fact, the initiatives relating to health services can be found on page 36. I mean, those few paragraphs. But then, you know, there are many problems that deserve our attention. But then 689 is silent on many of the problems, but he has recently told the media that not mentioning doesn't mean that nothing is being done. Now, I think he is in fact smarter than Mr. Tong. Mr. Tong merely says that if he doesn't mention that policy is no longer there. So does it mean that whatever 689 hasn't mentioned, he in fact it doesn't mean that he is not doing those things? Now, I want to say that the services provided to NT West is are inferior to those provided to other clusters or regions. I hope that the situation will improve with the completion of the Tung Chung Hospital and Tin Shui Wai Hospital. But then for Tuen Mun Hospital and Pok Oi Hospital, There are, of course, inherent problems with these hospitals. I believe, Secretary, you understand the inherent problems associated with Tuen Mun Hospital, and I hope that the $13 billion project can help rectify the problems that exist at Tuen Mun Hospital. And then I would like to say something about dental care services for the elderly. In fact, this point has been made by many members, and I hope that resources can be used to address this need on the part of elderly citizens. And then HPS, it's like a gold mine to the insurance sector. We don't want the HPS to be like the MPF. The MPF has become the ATM for the financial services sector. And then finally, Columbia. The policy address is silent on this issue. So this is really disappointing. Do you know that there is a shortage of flares? There is a more severe shortage of niches. There is 1 minute for the Secretary to give replies. Secretary. Yes, Chairman, concerning NT West, we are looking at a few measures to try to improve upon the medical and health care services provided in NT West. Now, the review committee on HA looks at the allocation of resources to different clusters. In fact, I understand that there will be an item later this afternoon on the resource management in the HA, and we hope that resources can be more fairly allocated among the various clusters. And there are many plans for improvements in the NT West, including the $13 billion project. And then for Tuen Mun Hospital, with regard to surgeries, we will carry out a feasibility study on the increase in the number of operating theaters, and the increase will be a large increase. Ms. Alice Mack. Yes, Chairman, a few points. First of all, on the elderly health care vouchers. Now, I understand that the Guangdong scheme will be expanded to other provinces, and so and there will and places will also be bought in the mainland with regard to homes for the elderly, and I want to know whether you are carrying out any studies on the health services front, given that the government has the policy to encourage elderly persons to retire in the mainland. And then the vouchers. I of course support the increase of the value to $2,000. Elderly persons can, of course, use the money to enjoy primary healthcare services. But then elderly citizens also need dental services, and there isn't enough money for them to use dental care services. So I believe the elderly persons will leave the $2,000 for flu and other illnesses and not dental care services. And then also understand that there is this pilot scheme or pilot project on dental services, but then this pilot project serves a particular group of elderly persons only. Last year, the policy address said that the drug formulary would be expanded. I want to know what's going to happen to the drug formulary this year. Will the drug formulary be expanded, in particular target drugs and psychiatric drugs? And then you are suggesting that a community healthcare centers be set up. I want to know whether there will be one in each district. How many of these do we have at the moment, and how many will be planned? There will be a new hospital in the Kai-Tak development area. Will it replace QE, or is it going to be an additional hospital for Kowloon East? Yes, thank you, Ms. Mack. Concerning the portability of elderly health care vouchers, we are still studying the matter. This is because there are some technical issues involved. For other welfare benefits, they are deposited into the beneficiaries' bank accounts. So the benefits can be continuously deposited into the beneficiaries' accounts. But then for the elderly healthcare vouchers, these are not deposited into the beneficiaries' accounts. In fact, the records are in a computer system. And so if there are medical organizations in Guangdong which can provide the service, we have to make sure that they can be connected to our computer system first. And then there is another technical issue, that's the exchange rate, because the exchange rate changes every day. So we may be talking about services provided in the mainland through CEPA, or the Shenzhen hospital operated by Hong Kong U. So we need to have a study on these matters. And then if there are CEPA organizations operated by NGOs, that would be easier, because these NGOs may be willing to receive Hong Kong dollars. Yes, Ms. Priscilla Leung. I want to say, Chairman, that I welcome the idea of a Chinese medicine hospital. In fact, we have been eagerly waiting for the construction of a Chinese medicine hospital in Hong Kong. And then we understand that there will also be studies on Chinese medicine. I can remember that during the days of Mr. Tong, it was said that a Chinese medicine port would be established, but then in Mr. Donald Tsang's days, the 500 million Jockey Club Fund was scrapped. So I want you to set a timetable for the study. Then I want to know more about the operation of the proposed Chinese medicine hospital. There are Chinese medicine hospitals in Guangzhou which are very successful. So I want to know whether we can learn from them, and then next, in fact, I do consult chiropractors from time to time. And in terms of the treatment and other aspects, chiropractors are of the view that they are not treated fairly. So it's like the situation that Chinese medicine practitioners encountered some years ago.
Hong Kong is an aging society, and a lot of elderly have purchased insurance, medical insurance, but they cannot afford it after retirement. But if their children pay the premiums, could the children also receive a tax break? The policy address also mentioned the government purchasing 3,000 places in Zhaoqing and Shenzhen. So how would the elderly receive health care in those places? In the TCM hospital, I had explained that to build a TCM, it would take 4 or 5 years because the site is formed, but it would take time for planning. But I will promise that we will like to clear internal government hurdles approval procedures and so on. Will we make reference to the mainland? We can, but we cannot copy it verbatim. The Western Chinese medicine cooperation is different in the mainland. We have to do our own TCM Western medicine cooperation programs. Regarding insurance, where there can be tax relief or incentives, I cannot answer you now. I don't understand your chiropractic question. Their fee is determined by the market. The government cannot intervene. Or they cannot get sick leave from, patients cannot get sick leave from chiropractors. Only registered Western the medical practitioners, TCM practitioners, can issue sick leave. Regarding dental care, civil servants will get a new dental clinic. It will provide dental care services. We receive a lot of cases. We would like to have more elderly dental care services. And now you're using civil service quotas to help the elderly. And now you want to strengthen dental services for civil servants. Well, we do not object against that, but you are improving on something existing. But the elderly quota, we have very little quotas for these services. So when the government is building this new civil service dental clinic, could you add more quotas for the elderly? This would help you avoid the negative impression that the government is only looking after civil servants. The second question is about colorectal cancer. I'd like to ask the Secretary, have you considered early screening for breast cancer? Because the breast cancer is the third highest mortality for women in Hong Kong. So there are 54.8 women with breast cancer per 100,000. That is much higher than the global average of 39. In Asia, we have a very high prevalence. Singapore, Taiwan, Japan's figures are available to you. Hong Kong does not have a good record. There we have more than 3,000 breast cancer cases. Average age is 50-odd years. So would you consider screening for breast cancer for high-risk groups? So it would be those above 45, 50. Could you provide breast cancer screening so that this issue can be resolved? Because Hong Kong women, 1 out of 19 might get breast cancer. Well, two questions. The government will build a dental clinic for civil servants. This is welfare benefit regarding civil service remuneration. It's got nothing to do with my bureau. I mentioned that the elderly in the community, we would like to strengthen their services and reduce the threshold for them through the community care fund. Regarding breast cancer, it's different from colorectal cancer. There are 3 coloscopy, and blood testing is there's high efficacy for early screening through these measures. But using X-ray to screen for breast cancer, this methodology there's still doubt on its efficacy. This is controversial. Is it because of treatment is better, or is it early intervention? So we have a survey now. It will take 2 or 3 years to collect. It will collect recent data on screening to see whether breast cancer screening is the efficacy of breast cancer screening. I would like you to step up with this study. Second round, Ms. Priscilla Leung. Well, I'd like the Secretary to clarify. Will we have a timetable for the TCM program? There was a study on the efficacy of TCM during the SARS period. I'd like to revisit the mobile dental clinic. This is very popular with the elderly that are immobile. And third, the expensive drugs, except for cancer target drugs, we also have expensive hypertension and Alzheimer's medication. In paragraph 26, you said you will expand the drug formulary. Well, first of all, in the TCM program, we won't just wait for the HA. We are already drafting a policy on TCM development. For the mobile dental clinic, the majority of these are run by NGOs. Of course, if we expand the scope of cooperation with NGOs in the Community Care Fund, in the provision of dental services for the elderly, the NGOs can work through this mechanism. Regarding the drug formulary, this is an ongoing effort. This year, the focus is on psychotropic drugs. We want a more concentrated effort on new psychotropic drugs. Aside from psychotropic drugs, the HA has a mechanism to renew the drug formulary. When their drug has a certain efficacy, there is a mechanism to introduce it. The mobile dental clinic the mechanism does not limit the provision of services. Fernando Chung. The Secretary seems to have misunderstood me. I'm not saying we don't want to combine cognitive defects with the elderly. You always use age to draw a line. The elderly healthcare voucher, it targets the elderly. But aside from elderly, those under 65, we have a lot of chronic patients with chronic diseases. They have cognitive difficulties. So when you do a lot of preventive work, it's only provided to the elderly. Let's say a mentally disabled person, they might be 50, but their health might have deteriorated to the equivalent of a 60, 70-year-old. So their life expectancy is lower than the average. So I'd like you to re-examine this. And the Kai Tak Acute Hospital, are you relocating QE, or is this a new hospital? We need to clarify that. So do we have other uses for QE? And you talked about the general outpatient PPP. I'd like you to provide some evidence. What review have you done? How do you draw reference from Tin Shui Wai? And what leads you to promote this scheme? Well, first of all, I thank you for your remarks. And on the next occasion, we will consider this problem. The Kai Tak Acute Hospital is a new hospital. QE, at the same time, it will be 50 years old. There is pressure to redevelop, but you are aware, in the policy address, we have separated these two. We talked about Kai Tak. We don't want you to mix the two together. But at a certain point, if QE, redevelopment, if we could utilize the Kai Tak Hospital as part of the redevelopment, then I do not rule out that possibility. But I don't have a better Chinese term for it, but I have to use the term decanting. That means if we redevelop a hospital, where do we conduct the existing services? So decanting is having another hospital serve while the redeveloped hospital is under construction. So I won't rule that out. Rule out that use. But Kai Tak is not going to substitute QE. So this Kai Tak Comprehensive Hospital and the Pediatric Center of Excellence for Pediatric Care and the Neuropsychology Unit, could you clarify? We've felt that having these hospitals in close proximity, there should be mutual, complementary, and synergistic effects. So the Center for Pediatric Excellence is a separate building. That's a matter of fact. Construction has already started. But next to it, the Kai Tak Comprehensive Hospital. In the future, I hope that it can provide mutual support with the pediatric hospital. And regarding the neurosurgery, the neuropsychological, we will not build a separate facility. So I hope that through planning, the psychological unit can be combined with the Kai Tak Comprehensive Hospital. Next, Helena Wong. Thank you, Chairman. I'd like to ask about this smaller book, page 75.
Page 75. So the administration will provide quality public sector healthcare services by improving upon HA services, including and stepping up service for the elderly, stepping up convalescent care, and also enhancing the management of the waiting time for general outpatient services and specialist outpatient services. But I can't see any commitments or indicators in your paper to convince us that you will be providing quality public sector healthcare services to the public. Now, Chairman, some people say that we haven't said too much about healthcare services in the policy address, but I want to say that in fact, many of the major initiatives in the healthcare sector are ongoing initiatives. And so you may not find too much content in the policy address, but in fact you'll find out more details in the policy agenda, and Dr. Zhang will be able to supplement here. Yes, Chairman, due to time constraint, I'll try to be very brief. The hospital authority will continue to provide our services through increased funding from the Food and Health Bureau. So concerning elderly enhancement of elderly services, general outpatient service, and so on and so forth, will seek improvements with enhanced resources. But we don't have any indicators. So what do you mean by stepping up the service? Does it mean that you're able to handle one extra case per year? What do you mean by enhancement of services? If the authority and the Bureau do not have any indicators, then how can we measure your performance? How can we judge whether you've really made improvements? Dr. Leung. So when the budget is published, we will specify where we'll be providing extra beds. For example, cardiological services, mental health services, or psychiatric services. Now, in fact, we have a lot of information available already, but then I think I will give members a detailed reply in the budget exercise. We do have indicators: how many beds, how many consultation sessions, and then number of CT scan or MRI sessions. I think it's important to have these indicators, or else we can't really assess whether improvements have been made or not. Secretary? So when the budget is out, you see how many additional sessions will be available for the various specialties. Now, perhaps the Secretary can now give replies to certain questions that have not been answered. For example, colorectal cancer screening. Yes, Chairman, Mr. Wong asked how we will select people for the screening. We haven't made decisions yet on the age group, for example. Once we've made the decisions, then we will write to those in our target groups to receive screening. But of course, for those outside our target groups, they can, of course, make use of their own resources to receive screening. For example, they can approach their family doctors. And then non-local doctors, I've already said that the Medical Council has decided to increase the number of licensing exams, and the internship arrangements will also be relaxed. And then A&E department, Mr. Pun Shu Peng asked this question. Dr. Zhang. Yes, concerning the A&E departments, now the waiting time is long because of shortage of manpower. So we'll need to retain our staff. We need to step up recruitment. We'll try to recruit doctors to serve on a part-time basis at our A&E departments. And also, we will provide an allowance to doctors who are not on duty so that they can serve at any department to deal with semi-urgent or non-urgent cases. Right? Anything outstanding? Anything else? I think there are some issues that can be followed up on the next item on the agenda. The drug formulary. I understand that two more drugs will be included, right? Yes, Chairman. Mainly on psychiatric drugs. We will give more resources to the HA so that those of serious psychiatric illnesses can make use of new drugs. And as Dr. Leung has pointed out, we will have the details in the budget exercise. For example, the types of drugs to be included. And Secretary, in the laws of Hong Kong, we do not have a definition of Chinese medicine hospitals. So this is that the proposed hospital will also provide Western medicine services. Now, the laws in Hong Kong do not stipulate that hospitals must be providing Western medicine treatment. So, if necessary, we will introduce legislative amendments. But our existing ordinance doesn't require that Western medicine be practiced. But it says modern medical services, in other words, Western medicine. But I want to say that for the proposed hospital, it will mainly be providing Chinese medicine treatment. And for Western medicine treatment, that will be the types of procedures that will complement Chinese medicine treatment. But say some Chinese medicine practitioners may also prescribe MRI service. We haven't decided on the scope of services to be provided in this hospital. Basic X-ray services, yes, I think, but as there will be Western doctors or Western medicine doctors in the hospital, so X-ray machines can be operated. But then you are proposing to get an NGO to operate the hospital. So, in other words, this the hospital will be able to provide the full range of services unless you impose certain restrictions in the lease, or you impose certain restrictions in the contract between the government and the operator. Now, if private hospitals want to expand their clinical services, they have to apply to the DOH and must have the prior approval of the DOH. All right, thank you very much. We can now move on to the next item on the agenda.
咁下一個議程係醫院管理局各醫院聯網嘅資源分配。
Our next item, resource management in the hospital authority, and I believe members have already received the paper.
Okay， 咁局長可以。
Yes, the secretary. Yes, I'll just give a brief introduction. So this paper introduces to members the resource management system in the HA. We need to make sure that no person shall be prevented through lack of means from obtaining adequate medical treatment. And in fact, in 2013-14, we approved $44 billion to the HA. We have to make sure the hospital authority has the adequate resources to take care of patients' needs. The hospital authority was set up over 2 decades ago, and in fact, there have been challenges, there have been changes in the healthcare service environment. So the HA's resource management has been evolving over the past 20 years to align resource allocation with areas of need. Now, concerning our resource management arrangements, I want to say that at the moment there is an overall review on the HA going on. But today I want to invite Ms. Clara Chin, Director of Finance, to brief you on the present resource management arrangements. Ms. Chin? Thank you, Chairman. Thank you, members. I will introduce to members our resource allocation mechanism and the monitoring arrangements. In fact, we have been trying to perfect our resource management arrangements. We hope to provide quality and effective services to patients with limited resources. We provide continuum of care, and we also try to optimize effectiveness of care for patients. So these are the key values in resource management. We hope that members of the public can, in their clusters, receive primary and some secondary level services. We have clusters providing comprehensive services to the public, including 24-hour A&E service, inpatient services, day services, outpatient services, and also community services. We also try to optimize the effectiveness of medical services. Now, for highly specialized services which require advanced technological support and special scarce expertise, they operate across clusters on a territory-wide basis. Examples include neurosurgery, oncology, organ transplants, bone marrow transplant, and burn management services. In order to achieve better clinical outcome and efficiency gain, some medical services have been put under the management of a single cluster for serving the whole of Hong Kong. These include the blood transfusion service at Kowloon Central Cluster and the infectious disease block at Kowloon West Cluster. They serve the entire Hong Kong population. We provide patient-based services. We have been trying to perfect our resource allocation arrangements. We need to make use of objective means to align resources to areas in need. In para 9 of the paper, we try to introduce to members the HA's IRA models, which have evolved over the past 2 decades. Now, in the 1990s, we allocated resources according to the agreed service level and targets of hospital.
So we used a population-based model where resources were allocated based on population, community needs, and we made the necessary adjustments. In 2009, the IRA model, the internal resource allocation model, was refined under the concept of pay for performance. In 2012, the HA initiated an internal examination of this P4P model to reinforce its effectiveness in aligning resources with its service plan. Now, just now I mentioned that our long-term objective was to continue care for patients in their community, but given the changing conditions to balance supply and demand, we know it's rather complex. The cluster populations, the demographics, the age demographics, for example, their economic background are different, and all these will change with time. So these factors will lead to changes in the level of scope, services, but on the other hand, facilities and hospitals had already existed before the existence of clusters. These facilities were not planned on a cluster basis, and therefore there was mismatching between supply and demand of hospital facilities. So some clusters are mismatched. So the HA has made efforts to address this mismatch through planning, through building new hospitals, facilities, expansion of clinical services, and development of new services. And this planning would determine how resources are allocated. In paragraphs 11 through 15, we talked about the planning of resources. So in between 2012 2017, we have set up short-term and mid-term plans. So through examination of internal and external environment, we'll plan our resources. The planning of the deployment of resources needs to be, we have participation from different stakeholders, including the patient groups, the management, and administrative staff. I mentioned that the annual planning is very complex. It has to meet the changing environment. It has to meet increasing demand. So it's very hard to come up with a single formula to meet all needs. So in deploying limited resources, we need to consider a lot of factors. Aside from the service population, the demographics, the demand for services, and all these have to be considered, including new services, upgrading of facilities, and the procurement of pharmaceuticals. In paragraph 16, we listed the resource deployment for the clusters in 2013 to 14. In column 1, we refer to the ratio of funding. Rows 2 and 3, they list the population and the percentage of patients they serve. So you see there are differences between the two. For example, in Kowloon Central, it only makes up 7% of population, but it serves 13% of the population. So you can see that the ratio of use and the resources they have, it's different. So aside from difference in population numbers, the economic background and so on are all different. We also have patients using the services of different clusters. So aside from referral of specialized services, we see that when patients transfer to a different, when they relocate to a different district, they would like to receive medical care from the original cluster. For example, in Kowloon Central Cluster, between 2011-12, they had served some 63% of patients residing outside their catchment districts. If we look at the complexity of cases, we can see the resources consumed in A&E. So from these figures, you can see that the percentage of resources they receive is similar. But since A&E only represents the 50% of total expenditure, this observation illustrates that HA's resources allocation largely follows patient services. After resources are deployed in the clusters, performance monitoring is an essential aspect. So, in addition to annual plans, the HA has also established key performance indicators to facilitate tracking and measuring of progress. In paragraphs 11 to 15, we talked about the different internal and external KPIs. Lastly, in light of technology changes and the public's demands and expectations, the HA will continue to review its management, and we hope that we can ensure that our resources are being deployed efficiently and optimally in the delivery of quality care. Thank you, Chairman. We're now opening up to legislators. 郭家麒、麥美娟、黃碧雲、田北辰、潘兆平。4 minutes. 郭家麒. I've read the paper, and if you refer to your paper, you can argue that Kowloon Central or even Hong Kong West, even though their recurrent expenditure compared to population, compared to new NT East or West is much more. You also said we have to look at the complexity of the cases. So we only have 7 million people in Hong Kong, and we already have 7 clusters. And you see that in the 7 clusters, the service quality varies. Whether you look at waiting times, the ratio of doctors to patients. So, for example, in NT West, if you compare it to Kowloon Central hospitals, Queen Mary, there's a waiting list of 30 months. So for maternity and optometry services, it's the same. Recently you saw that HA, on their own audit figures, you can see that this is just the tip of the iceberg. I'm most disappointed that these problems have been in existence for more than 20 years. We're not looking at statistics alone. Patient care in different clusters is different. Please take a look at Tuen Mun Hospital. Recently, a nurse told me a 50-year-old patient went to Tuen Mun Hospital for appendicitis. He was just given a diaper. We don't have a urinal for you. I'm in my 50s, and if we are admitted to hospital, we'll only be given an adult diaper. So is this something that patients deserve? Well, we can't blame the hospitals. They don't have enough staff and resources. But over the years, you are saying that it's complex. In Kowloon, they can, the Kowloon Central, Kowloon East, I've received a lot of patients. They said the queue is too long. Could you write me a referral letter to QE? They can go to Caritas. But if you live in Tuen Mun, Tin Shui Wai, it costs $20. It takes 3-4 hours, and they're ill. Why don't you look at their needs? It's been 20 years since 91-92. The HA fiefdom or heritage issues has not improved, and it gets worse and worse. I can see you've identified the problems, but there's no solution. So I'd like to ask the Secretary, is this going to continue? I think Mr. Kake hasn't heard my explanation. The HA resources, they have a review committee. This is one of the issues they're looking at. We've asked the HA, that is in response to legislators' request, to explain how the resources are deployed. But looking forward, I've already pointed out that we have set up this committee to review this issue. We've already highlighted that we have the determination to deal with it. Of course, we have to wait for the review committee before we can make any proposals. And I believe so. I hope you understand. Well, on each occasion you say the same thing. Could you follow up? Mak Mei Kyun. Well, I think, Chairman, we want to know and how resources are deployed. We would like to see some improvement, but I want to tell the Secretary, and we also want to tell the HA staff that we're dissatisfied. We're talking about the resources are not deployed fairly amongst the clusters. Kowloon West, their population, the demographics, and NT West don't have a lot of private hospitals and private doctors. They have no alternatives. They might be able to use your voucher in other clusters, but not in NT West. They don't have choice. They have to use public facilities. So the demand is very large. So I don't know what kind of review you're going to end up with, even though you say some specialist services can be delivered across the different clusters. But certain services are not allowed to be, cannot be transferred, such as psychotropic services. And we also have union. We see that the union amongst the different clusters, they say that frontline workers, their vacation leave, their lunch breaks, meal breaks are all different in different hospitals. So some clusters, such as NT West, they have a high pressure. They find it hard to recruit staff. So the HA, in your review, can you solve these problems? Because ultimately, if the frontline pressure is so heavy, then the patients will suffer. Some workers have to extract phlegm. They need to help wrap up the cadaver, and nurses have to do administrative work. They have to do a lot of paperwork. So if the system doesn't change, no matter how the resources are deployed, if the human resources are not managed, and if you just add different systems to it, that ultimately the patients will suffer.
And so I want to know when the report will be available and what can the HA do in the interim. Secretary. Yes, thank you. Now, the fact that a steering committee was set up shows our determination. In fact, people have pointed out certain problems for many years. So we want to really face up to these problems, and we want to find solutions to these problems. But when we can't make recommendations based on observations, we have to justify the way we allocate our resources. And so I don't think I can tell you now at this stage that resources should be allocated to this area and not that area. Ms. Helena Wong. Yes, Chairman. Now, of course, we want to make sure that the resources are fairly allocated to different clusters. Now look at Kowloon Central or Kowloon East. You can see that patient percentage 13.1, 13.3, but one get 13.9% and the other get 10.7% concerning recurrent funding. So it seems that Kowloon East has been given less resources. But I really hope that the Bureau will make sure that resources are fairly allocated. And I hope that the Bureau will consider the following. In the year 2013-2014, $44.4 billion were allocated to the HA. This is by no means a small amount of money. So the HA has to make use of this amount wisely and effectively. And want to know how many percent of this amount should be spent on drugs, and how many percent on the hardware, the equipment, and how many percent on staff remuneration. And what are the respective ratios in the public healthcare sector in other countries? Say, for example, in Hong Kong, are we spending a percentage which is below average in drugs? And many people have criticized the HA for creating senior posts and creating much fewer junior posts. So I just want to know what you're going to do about this. Secretary. Now I think Ms. Helena Wong's suggestions are constructive. Ms. Wong is suggesting that too much resources are used to create senior posts at the management level in the HA. Now, of course, there are no international standards as to the optimum size of the management, but I agree that we should take a look at this. And then equipment or hardware. Now, it's hard to make comparisons because this is not an item of recurrent expenditure. But then drugs and remuneration are recurrent expenditure items. And of course, these items are affected by the salary structures. And also concerning drugs, in different places because of intellectual property factors and other factors, the price of the same drug may be different in different places. Now, I'm not saying that the management in HA is really too big, but as so many people are concerned about this matter, I think it's worthwhile taking a look at this. Mr. Michael Tian, Secretary, we have 4 GC directly elected members here, and 3 of them represent NT West, and I believe you know why. And then the Tin Shui Wai Hospital will be commissioned. Yes, I understand that there is the steering committee on HA, and there is a review, so I want to ask you questions about that. But then there are assets which can't be bought with money, and I'm talking about staff, doctors. I understand that many doctors do not want to remain in public hospitals. They want to join the private sector. They are complaining that the workload in the public sector is really too heavy. Now, now in the retail sector, now if we can't hire enough people for certain jobs, we have to offer allowances, attractive allowances. But now you insist that there should be equal pay for equal work, equal pay for people of the same grade or the same rank. But then because some people just simply do not want to work for a particular hospital or a particular cluster. So can you try to achieve some breakthrough in this regard with regard to your mindset? And then local doctors, we understand that it takes time to have flour becoming bread. So it takes time to train local doctors, and then we have very few doctors coming from outside Hong Kong, and doctors in the private sector want to leave the public sector. And I understand that the CE is eager to find enough sites for housing development, and you are eager to find enough people to fill the posts in our public hospitals. And I understand that some of our local doctors are leaving Hong Kong. They prefer to work outside Hong Kong. So we don't have enough doctors. And the doctors that we have trained are leaving Hong Kong. So can you try to address these issues? Thank you. Thank you very much, Chairman. I thank Mr. Tian for his questions. First of all, salaries and allowances. I understand what you mean. You want us to exercise flexibility in this regard. Now, I do encourage the HA to exercise flexibility in this regard, but I do understand the difficulties faced by the HA in this regard. Now, HA colleagues are like colleagues in the civil service. They expect the HA to implement fair remuneration policies. But I myself am inclined to give the HA more flexibility. Now, and I understand that the HA has been given more flexibility in recruiting part-time doctors. But then as to whether we can offer different rates of allowances for doctors serving in different clusters, we have to be very careful about this idea. And then doctors, the medical council has decided to run one more licensing exam every year. And then internship arrangements will be relaxed. Certain waivers will be provided. And the medical council is now considering ways to facilitate overseas doctors getting registered in Hong Kong through passing the licensing examinations. Now, I want to say that, in fact, within the HA, the wastage rate among doctors has gone down because of the various measures implemented to retain doctors. Previously, the wastage rate was over 4%. Now it's over 3%. And concerning doctors leaving Hong Kong. Now, the problem is not very serious now. It was serious in the 80s. It's true that doctors do leave Hong Kong from time to time, but then this is really not a very serious problem at the moment. But we, of course, do have doctors from the private sector going to the private sector. Some people have said that we should open the doors wide to doctors from overseas countries. But then now I want to say that for doctors with limited registration, they have to serve in the HA. But then if we allow doctors to from overseas to come in without having to sit for examinations, they may choose private practice. They may not join the HA. Now, in fact, there are many who are of the view that the private sector is capable of handling more cases. In other words, in fact, the services provided in the private sector have not been really fully utilized. Mr. Pun Shuping, now concerning the allocation of resources in the HA, it is said in para 9 that the HA initiated an internal examination on the P4P model in 2012. I want to know the outcome of the review. Yes, I understand that the recommendations will be out after the steering committee has completed the study. So I think we should be talking about August 2014. But I want to know whether the review can be expedited so that we will have the recommendations earlier. And then we understand that different clusters are trying to secure more resources, and they try to keep the resources to themselves. And so it has been suggested that there should be a rotation of the different HCEs among different hospitals. And I want to know whether this arrangement will be adopted. Yes, I thank Mr. Pun for the 3 questions, Chairman. Concerning the deployment of HCEs, we have had a new round of reshuffling recently. Changes are made when there are HCEs leaving the service or retiring. And then as to whether the report will be available in August, I really can't promise. We did say that we wanted to use about a year to carry out the review. But then concerning the resource allocation formula, it hasn't been discussed by the steering committee in great detail yet, and I will not rule out the possibility of relying on consultants to study the subject for us, and so I can't promise that it will be in August 2014. And then with regard to the internal examination on P4P model that started in 2012. Perhaps Dr. Zhang can reply. Dr. Zhang. Yes, Chairman. Thank you. At that time, we said that if clusters could promote their productivity, then they would be able to get extra resources. Now concerning acute diseases, we do have the indicator concerning the seriousness of the illnesses, but then we're only talking about acute admissions only.
We also have a lot of rehabilitation, outpatient, and community service. So just relying on one indicator for resource deployment would not be appropriate. So we hope to use service planning. That is, we can forecast where we need additional services, then we can use hardware, software to coordinate. Any follow-up? Then it's my turn. Just now, the government said that there wouldn't be, nobody should be denied medical care because of lack of means. It's a matter of principle. The HA colleague made a lot of explanations on how to rationalize resources deployment, but the end result is that some clusters, the majority of specialists have longest waiters. For example, we have 15 weeks, 107 weeks. This is a recurrent trend. So that means the calculations were wrong. Because if your calculations are correct, in paragraph 16 you said NT West should reduce resources from 13.2%, then and Hong Kong West should increase funding. Why do we examine this? Because you said your review committee is looking at this, but the doctors in the review committee, 5 or 6 doctors, and 3 of them are from Hong Kong West cluster, and a lot of them are of a certain specialty. So so your paper is targeted to different audiences. So how much technical content have you presented in this paper? I think this paper is much simpler than the one submitted to the review committee. I don't understand. I don't see how the review committee could make recommendations based on this document. So you should provide the papers you're submitting to the review committee. So could we be provided with the detailed figures? So even if it might be 100 pages, there would be some legislators interested. For example, in paragraph 14, you refer to recurrent funding. So in paragraphs 14, 1, 2, and 3, could you provide the actual figures for the different clusters, such the resources needed to sustain the baseline operations, the pharmaceuticals, the salaries, and other operational costs? And 2, how much you're spending in areas 2 and 3? Could you give us a detailed breakdown in the last 5 years so we can look at it in greater detail? Yes, the statistics in the last few years is available. If you want us to conduct analysis, that can be done. Mr. Kokake, Chairman, I'm very disappointed. The government is not responding. We had invited the new chairman, the CEO. I agree with Chairman. The review committee papers and information papers should be submitted. And in the interim of the review, they should come and report to us. It's like the long-term housing strategy. The government would report every once in a while, same as the Poverty Commission. So I hope that the Secretary consider, for example, the Chairman said some clusters, there's a waiting list of a few years, some waiting list of a year and a half. So is the HA does the HA have its hands tied? So in clusters with shorter waiting lists, can they help with exceptionally long waiting list clusters? NT East, Kowloon East, or could some staff go serve across the different clusters? We've seen this before in the HA or during the we've seen people being seconded, but now with different clusters, they're just looking after their own cluster. They don't want their staff or funding to be touched. This culture within clusters doesn't help patients. So you can continue to review. My question is, could you do actual work? And Chairman, since we'll have a committee to look into this after the Chinese New Year, I'd like to invite deputations such as frontline workers, public hospital doctors. After the CNY, we'll be talking about the inequities within the clusters. So we should invite the relevant bodies. So I agree that the Secretary says we have to deal with foreign doctors very carefully. I'm concerned some consultants are already worried. We are forecasting that some 200-300 graduates will join in a few years, and I'm more concerned whether the government has enough money to hire them. I'm worried about doctors taking to the streets like in 2008. We don't want to see that again. Secretary. Interim report. At any point, we can update you of our progress. The suggestions you put forward, such as clusters with a shorter waiting period, can they help clusters with a longer waiting time? The HA is already undertaking such measures, and if one cluster, can they second staff to another cluster? I've supported this all the time. I've always supported this. So I hope in this review we can mention that even though there are deficiencies in the cluster system, even though Hong Kong is not large, but we need to take a cluster approach. The HA, I expect the HA during emergency situations, they should be able to deploy resources. That is our expectations of the HA. A few days ago, when I was having lunch in one large cluster, some consultant doctors, because of political reasons, they only had 2 operations in a month, and the rest of the time they were waiting. You don't laugh, you know who I'm referring to. That's ridiculous. Some people cannot see a doctor, and some hospitals, or are they in a political contest, they are not operating. This is something that we regret. You are aware of the situation. This is probably something different from what I said. I said I support resources being shared across clusters. The HA should have that authority. Mark Maygoon. the Secretary will find my comments unconstructive. You referred to our observations, but if there is such an observation, that means it is true. The fact is, NT West frontline workers, they outlined the problems they're facing, and we said that in the private hospitals, private doctors are insufficient in NT West. We have figures. We have the lowest figures in NT West. So the demand for public service is not just my observation, it's a fact. So why do we call for a deployment of resources? And we're disappointed if you cannot come up with a decision by the middle of the year. We want you to help NT West patients, but now you don't have a timetable. And the chairman said the different specialist waiting times, these are our facts. It's not just an observation. So if you find my comments unconstructive, I would still urge you I would like to know, as a person not proficient in mathematics, could you tell us what methods do you have to resolve the problems, the deficiencies we have in NT West? The lack of resources affects our ability to recruit and affects patient outcome. So when can you resolve this in equitable division of resources? Well, I'd like to clarify. I have not said that legislators have unconstructive comments. Regarding the formula for deployment of resources, I need to repeat. You want us to do this work as soon as possible, but if the outcome is incorrect, that's also very serious. So we have the responsibility to do the job and do it right. So in this important review, I cannot pledge that this review will be concluded in a few months. The HA has been established for so long, well, but then we will not drag on forever. Just that Mr. Poon referred to a specific date in August, and I just said that I cannot meet the target deadline of August. Actually, even though we don't have a formula, but we have a mechanism to evaluate the services, the demand of services in the different clusters. In NT West and Kowloon East, in the last few years, we can see that facilities and services are deficient. So in the last 5 years, our deployment of resources in NT West and Kowloon East, they had the highest increase amongst the clusters. So you don't need to worry too much. We are looking at the demand for services and deploying resources accordingly. So we'll have an outcome after the review. I need to extend by 15 minutes. Still some matters that we need to handle. I also have some follow-up.
Dr. K.K. Kwok, asked a question about the method. Now concerning the review committee, will it look at allowing patients to choose the cluster they want to go to? This is a bottom-up approach, and I think it's fair to the patient. Say the patient may live in NT West or Kowloon East, and if he is willing to do so, he should be allowed to queue up in other clusters where the waiting time is shorter. And then second, You said that, say, if there's a shortage of staff in a cluster, then the staff resources should be deployed from other clusters to help out. Now, in fact, I think what's important is that you give the cluster the money. Now, because there is surplus manpower in the private sector, so the cluster can hire me or Dr. Kwok to help out. Now, I think you look at the population in that cluster, you look at the queuing time, and then you give that cluster more money so that it can work out its own arrangements. So would the steering committee be looking at this suggestion? Chairman, concerning the cross-cluster arrangement, are you talking about the present or after the review? The present. So, to what extent is this done at the moment? So I'll ask Dr. Zhang to reply. And then concerning Dr. Kwok's point, now, Chairman, you said that we should give the cluster more money so that the cluster could hire more private doctors. But I believe Dr. Kwok was talking about deployment of staff in other clusters to a particular cluster to help out. Now, I think when you give the resources to NT West or Kowloon East, the cluster should be able to use the money flexibly. For example, the hospital may decide to hire its own doctors to work overtime. Now, say for example, doctors in another cluster are having a very good time, and do you think you can really lure them to help out in other clusters? Now, in fact, at the moment, clusters do have the flexibility to hire private doctors, or private sector doctors to help out. And when they hire private doctors to help out, I understand that it's only 70% of the standard rate. The HA management is worried that if the hourly rate for part-time doctors is the standard rate, then there will be a more serious wastage problem on the part of HA doctors. But Secretary, now because the private sector market may become saturated, so although the wastage rate among HA doctors will increase, the increase will not be very serious, because I think there are both merits and demerits in adopting the standard rate for private doctors. So have you weighed the pros and cons? Now, I want to say this. The 70% rate is implemented not just because we are worried that the doctors will leave the HA and will then join the HK as part-time doctors. Now, part-time doctors if they are willing to be on call like full-time doctors do, then they do not receive 70%. They receive the full rate. Well, if these private doctors, part-time doctors, do not take on-call duties, they are not, or their duties are not equivalent to those of a full-time doctor. But of course, you may think it should be 80%. That is another matter. As we have some time left, I want to have a debate with you on whether these doctors have on-call duties. Now, say the doctors at Prince of Wales Hospital are busy, so I want to help out as a part-time doctor, and I get 70%. So is it that if I choose to be on, if I want to be on call, then I will get 100% the rate, because I used to be a consultant doctor, and in my group, I will be on call only 3 to 4 times a month, and in most cases, when I'm on call, I'll just be in bed from night till morning. Now, for consultant doctors. Now say, if I tell you I'm willing to accept on-call duties, I'm willing to be on-call, then is it that you'll give me 100% the rate? I think Dr. Chang can clarify the situation. For a part-time doctor, if he is willing to be on-call, then my understanding is that doctor can get the rate of a full-time doctor, but of course taking into account his working hours. But then if the part-time doctor doesn't want to be on call, then the part-time doctor will only get 70% of the standard rate. And then concerning what's going to happen in the case that the private doctor is a consultant doctor, then what's going to happen? Dr. Zhang, is it that if I'm willing to be on call, then I'll get 100% of the rate? If you take on all the duties, so to speak, the roles, the responsibilities, then the part-time doctor can get 100% of the rate. But then say, if I work 2 sessions a week, all right, 1/5. And then for full-time doctors, they may be on call 10 days a month. So in my case, then only 2 days on call every month. But 24 hours, round the clock. Yes, I know. But then for the 2 days, now because since I'm a consultant doctor, given my rank, it's most likely that I will be sleeping only. But of course, if you ask me to go to the hospital, I will, of course, be very willing to do so, because that would benefit the patient. That will be a case of life and death. Is that the arrangement? Yes, that's the arrangement. All right, members, do you have any further questions? Because it's about time. So I will seek further information from the Secretariat, and I hope that the Secretary can give us the papers with regard to the HA review. And then next item on the agenda, we need to have, we have this joint committee on or joint subcommittee on long-term care policies. And the WS panel has proposed that the joint committee be allowed to operate till the end of July this year. Any comments? Any objection? No? Then we will endorse this proposal by the WS panel. We have no other businesses, so the meeting is adjourned.